Daylight there is dark from opiate, heroin, and meth epidemics. There are bloodborne diseases such as HIV and AIDS, hepatitis B and C. Needle exchange programs were once viewed as helping minimize the negative outcome of HIV and AIDS epidemic of the 80s and 90s. Today, NEPs are a lot more public and not hidden from the communities. Harm reduction isn't just an alternative to recovery, it's another pathway towards recovery. The purpose of such programs is to reduce the spread of bloodborne diseases, which can be transmitted from person to person when needles are shared among users. Sharing of dirty syringes, cookers, and cottons, NEPs provides clean syringes, saline, cookers, cottons, and condoms. Services also provide persons who inject drugs with clean supplies along with health and social services, including education and substance abuse programs and medical care. According to the Center for Disease Control and Prevention, people who are in syringe exchange programs are 5 times more likely to enter drug treatment programs. They are 3.5 times more likely to stop injecting drugs. We do not have a healthcare system currently where we treat addiction as a disease, the way the doctors treat diabetes or hypertension. Reduction strategies are safety preventative procedures such as airbags or seatbelts. Common sense, low-cost ways to save the lives of people who inject drugs while also saving millions of dollars in medical costs per year. And points of view needle exchange programs by Lee M. Griswold and Ann. According to the Centers for Disease Control and Prevention, of estimated 47,500 new HIV infections contracted in 2010, 8% were related to intravenous drug use, and another 4% could be due to either to IV drug use or male-to-male sex contact. This is a significant decline from a decade previous, when an estimated 20% of new HIV/AIDS cases reported in 2000 were attributed to IV drug use, but the practice still represents a significant risk. In addition to concerning increases of hepatitis and HIV rates, CDC also identified additional emerging infectious diseases related to injection drug use, including increases in MRSA infection rates, which increased 124% between 2011 and 2016. Among people who injected drugs are 16 times more likely as other people develop invasive MRSA infections. Rates of endocarditis, a life-threatening infection of the heart valves that can occur in people who inject drugs, has also increased. For example, in North Carolina alone, the rate of hospital discharge diagnosis for endocarditis related to drug dependence increased more than 12-fold from 2010 to 2015, with adjacent hospital causes increasing from 1.1 million in 2010 to over 2.2 million in 2015. Identifying and responding to these emerging infectious diseases threat is critical to alleviate the substantial harms of opiate misuse and abuse. These infections have been linked to frequency of injecting and to syringe sharing. SSPs may help reduce bacterial infections by providing sterile injection equipment in linkage to substance use treatment. Public safety. Syringe serves programs can benefit communities and public safety by reducing needle stick injuries and overdose deaths without increasing illegal injection drugs or criminal activity. Studies show that SSPs protect first responders and public by providing safe needle disposal and reducing community presence of needles. As many as 1 in every 3 officers may be stuck by a needle during his or her career. Needle stick injuries are among the most concerning and stressful events experienced by law enforcement. A study compared the prevalence of improperly disposed syringes and self-reported disposal practices in a city with SSP, San Francisco, to a city without SSPs, Miami. found 8 times as many improperly disposed syringes in Miami, the city without SSPs. People who inject drugs in San Francisco also reported a higher rate of safe disposal practices than those in Miami. Data from CDC's National HIV Behavioral Surveillance System in 2015 showed the more syringes distributed at SSPs per people who injected drugs in a geographic region, the more likely people who inject drugs in that region were to report safe disposal of used syringes. Lucy Bradley Springer states in Needle and Syringe Exchange, Pride and Prejudice, evidence demonstrates that SSPs do not increase illegal drug use or crime. 43,044 studies in Baltimore and New York City have found no difference in crime rates between areas with and without SSP. In Baltimore, trends in arrests were examined before and after SSP and were open and found that there was not a significant increase in crime rates. The study in New York City assessed whether proximity to a SSP was associated with experienced violence in an inner city neighborhood and found no association. Needle and syringe experience an important component of HIV epidemic and must be prepared to defend its use. What can nurses do? It's important to be aware of these issues. Many other concerned citizens have been swayed by the rumors that NESPs will make the problem of drug use worse. Give them the facts. Many other sympathetic politicians are realistically concerned that voting for these types of legislation will be used against them in the future elections. Assure them that you'll continue to support their re-election efforts. Nurses can deliver a formidable political force, but only if become politically involved. It can be as simple as voting for candidates who have histories of positive public health activity. Some legislators have no idea about these issues. However, we as knowledgeable healthcare professionals have a duty to make legislators aware of our concerns. This is not hard as it seems. A phone call here, a letter there, a well-timed email message, or a visit register office can make a major difference. The bottom line is that these efforts are worth inconvenience when the alternatives that will not change an entirely preventable epidemic will continue to expand.
Nice job. Good time.